So hello everybody, and welcome to a live webinar from Dr. Clare at Dr. Clare's Apothecary. And I'll just check with Tara that we're online.
Yeah.
We're good. Okay. Always good to check these things before we head out.
YouTube, Facebook.
Great. So I have things to talk about this evening, which are to do with COVID-19. Some of you may have seen the previous webinar or presentation that I did based on traditional use and my own clinical experience, along with researched evidence for a selection of herbs. And we've been busy looking after people since then, but I haven't had anything new to say. And any of you who know me will know that I have nothing substantial to say that I won't take up the airwaves. So what's changed my mind? What led me to a new direction in terms of what might be of interest to you in terms of looking after yourself to do with COVID? And it's really in response to following a lead from another herbalist, which led me to a pharmacist in Trinity, Fabio Boylan, who wrote about ethnomedicine. And when I wrote to congratulate him on how interesting it was, he advised me of their research that they have recently put out on using herbs for COVID, which was in September 2020, and it happened to come to my attention. So thank you for that. The research article is COVID, is there evidence for the use of herbal medicines as adjuvant symptomatic treatment? So that's in addition to adjuvant symptomatic treatment. And it's published in Frontiers in Pharmacology. The team that wrote it are all eminent pharmacists, not clinical herbalists, not people who have a skin in the game, if you like, for promoting herbal medicines. And I think most pharmacists wouldn't disagree with me if I said that support for herbal medicine is the first thing on their list of priorities. So I'm very appreciative that this very eminent panel of experts from all over the world, from London, Brazil, Trinity College in Dublin, Poland. I think I have all of the different countries there. Forgive me if I've missed out on any of you. So they all got together to have an opinion based on the evidence. So when I think about COVID-19 and herbal medicine, I think, do herbs work? Are they safe? Are they dangerous? Because they're two actually different things. And the other thing that I think about is it safe to do nothing? Because basically there are three drug groups that people are advised that they may use, reasonably use, but always as often as possible to use them as little as possible, which always indicates to me that there's that they're not therapeutic. There's in terms of preventing complications or treating the underlying cause. So in looking at those four aspects, I then would think about, well, what I really want to know is what are the relative risks compared to otherwise advocated or endorsed treatment or doing nothing? And what are the belief systems behind the endorsement or lack of endorsement? Because either personal belief systems or authoritative belief systems have an awful lot to do with what kind of medicines we have available or that are endorsed. I would also want to know a comparison, the clinical comparison with reference drugs advocated by authorities. And is there a risk of professional liability and medical legal issues? Is that part of what would be holding things at bay, if you like? It seems very simple to say something is evidence-based or not, but that's really far, far, far too black and white. And evidence-based, I love evidence-based medicine, but there are a lot of nuances and a lot of limitations to evidence-based medicine. So, for instance, what kind of evidence is acceptable and how much evidence is sufficient? And they're two grey areas already, not to mention funding, lack of funding, etc., etc. So these are things to think about before we actually look, or before any of the authors look at any of the herbs. And bear in mind as well that herbal medicines are generally used as blends of herbs, and to look at the evidence for all of this, to look at of blended herbs would be another whole research project altogether. So we're looking at claims of supporting healing. So if I wanted to support healing for somebody with an acute viral illness, I would want to build up their reserves of their immune system. And I would also want to make sure that they have sufficient building blocks, because without the building blocks, which would include vitamin D, then you're not going to have good immune stamina. In the last webinar, I covered some of the particular features to comparing COVID influenza with the usual influenza, and duration and durability and stamina of the immune system would be included in that. So if we're looking not to prevent COVID or not to cure COVID, because I wouldn't dream of making such claims, if we set what we would like to do out as comfort, self-care, helping oneself rather than helplessness. If we also look at all animals when they're sick will actually choose herbs and specific herbs. So it's part of our co-evolution to use plants as herbal medicines. And herbal medicines are the basic core of every indigenous medical, traditional medical, well-established use medicine globally. So we're looking for support and sustenance would be how I would describe it. And then we look at the reference drugs, and the aim of the reference drugs is to suppress inflammation and suppress a cough. As herbalists, we would not want to suppress inflammation because inflammation is a healing reaction, and we want to moderate it, sustain and nourish it. And we definitely, as herbalists, do not want to smother or suppress a cough, which would be what would happen with codeine. So support inflammation and soothe a cough, as opposed to suppressing inflammation and suppressing a cough. So the reference drugs of the medical authorities have different aims from herbal medicine. And that might give us a big clue as to why the safety profile of the herbs that they studied is much more towards safety for the herbal medicines. So now we'll specifically go on to considering the information in this review of international knowledge. So yes, I think I missed out Venezuela. So hello to the researcher from Venezuela. So we have Brazil, Liverpool, Trinity College in Dublin, and Venezuela, and Poland and London included in the researchers. So I'll read their conclusion first, because you always like the conclusion first. Several herbal medications have safety margins superior to those of reference drugs, and I'll explain what they are, and enough levels of evidence to start a clinical discussion about their potential use of adjuvants in the early or mild common flu in otherwise healthy adults within the context of COVID. So I don't want to exaggerate the evidence or the benefits, but certainly a benefit of safety, as we will see, is a huge impact on whether or not these are endorsable or reasonable or open to discussion or whatever. There being no information is not an option in light of those safety. That's my opinion, not the authors. While they will not cure or prevent the flu, they may both improve general patient well-being and offer them an opportunity to personalize the therapeutic approaches. That is direct from the research. So one of the things about this article that I find very interesting and novel is that they actually compare the safety and effects of herbs with those of reference drugs. And the groups of drugs that are references are anti-inflammatories, analgesia, antipyretics, and cough suppressants. And they have chosen drugs to represent those groups. So the first one, as an anti-inflammatory effect, there is some evidence of clinical effectiveness in reducing inflammation, which is ibuprofen. It's a non-steroidal anti-inflammatory. It has a safety level of medium, and that's because of inherent problems with the ibuprofen, in other words, gastric bleeding, exacerbation of heart problems. Also, one which isn't mentioned is if somebody is also on antidepressants, which is not uncommon, it leaves them more prone to hospital-based infections. So there's lots of run-on things to do with interactions with these drugs. So the advice is as low as possible, as often as possible, and they also quote an possible antiplatelet effect, which is in common with some of the herbs, but it's potential and theoretical when you actually look at the practical clinical significance. Codeine is used as a cough suppressant. It can also be described as dextromethorphan on labels for cough remedies. It is also an opioid. Whether or not it actually suppresses a cough is open to controversy. And the safety is described as low. And it's ironic that so many of these products are available over the counter in the light of the massive opioid epidemic of misuse in primarily in the States, but it's happening here as well. It's just not as well publicized. So as an over-the-counter, starting somebody off with a potential for misuse is very short-term. And the other one is paracetamol. And the evidence of benefit in colds and flus is low, and the safety risk is low. And I'll quote from later on in the article where they say, despite massive use, these drugs have very common toxicities. Adverse effects are potentially dangerous in the context of Covid-19, and they reference that with drugs.com 2020. Ironically, I find this very ironic, trust in these drugs is based on familiarity and well-established use, rather than any scientific evidence for this role. So you could say that these drugs are being used because of traditional familiarity. So they're new traditions, if you like. It's not evidence-based medicine, it's familiarity-based medicine, which is another way you could describe tradition. So that's my little side reference there. So this comes to what's particularly novel and I would say exciting, but these things excite me because I love science, and I have two different bags that I use on a regular basis, which is the medical bag of medication and a herbal bag. And this is the first time I've seen these put side by side in a framework of common reference. So as a framework, I find this very exciting in terms of the future, because my real passion is integrated medicine. So under this PROACT URL, which is a framework of evidence, both favorable and unfavorable evidence of benefit and safety. And it's really designed for high-level regulatory level decisions. So it takes it beyond the personal, and it takes it beyond the professional allegiances and belief systems. So that's why that's my personal comment, why I particularly am excited by this. So just to bring this all back to my day-to-day life, I have a patient coach, and all of your family and many of your acquaintances. So Koch is 47. She's not particularly vulnerable group of people in the community. And she's had a mild fever for 2 days and a bit of a sore throat for 1 day. And she has poor smell and can't taste currently. And she's awaiting COVID test. So the authoritative endorsed position would be to do nothing and take nothing and just await developments. But I and the authors find that that is an unreasonable expectation, because you're awaiting developments and you're hoping that you get just a mild short-term illness with no sequelae, but you don't know that. And Koch doesn't know that. Or is she in line for a severe flu symptoms with a longer recovery? But given 4 to 6 weeks, she'll be back to her normal life. Koch doesn't know that yet. Is she in line for a prolonged flu illness with a prolonged recovery period? In other words, post-viral incapacity. And we're realizing that more and more people that a significant percentage of people are ending up with post-viral incapacity, post-viral syndrome, chronic fatigue, that scenario. And I am very familiar with all of that. And I find it very difficult that I have an apothecary full of herbs that people could benefit from, that could treat these as I really advocate treating as early as possible. So I'm very excited about this article, because it's my belief, based on my clinical evidence and familiarity, which I'm no longer apologizing for, by the way. It's my experience over 20 years as a clinical herbalist, that treating things early, preventing things escalating to a higher and higher level, the more you invoke your immune and inflammatory processes, the more difficult will be the recovery process, given that many of the people who are affected by the illness have low immune system to start with. So Kate doesn't know whether any of this is going to happen. And the worst case scenario is that there's a looming threat that if she hasn't recovered and she gets a dip in how she is around day 7 to 10, that she's in line for the possibility of a fatal illness, and certainly a very tough time in hospital, if not ICU. So we're thinking, would Koch be foolish to take herbs, or would it be a good investment of her resources and energy and a reasonable, rational decision? And no prizes for knowing what my opinion is. But that's of no matter, because we now have the opinion of these excellent experts who have gone to all of the research, and I know how much this work was involved in this paper. This is a huge body of work. So following a search of endorsed medicines, listed, catalogued by the European Medical Association or the World Health Organization, or national pharmacopoeias who quote sufficient evidence of effect for various symptoms of colds, flus, and viruses causing those symptoms, not specifically COVID, very important. And they also looked at some medicines, some herbs, those they called medicines. They also looked at some herbs which have well-established use, and they referred to them as remedies. They're not listed in any official pharmacopoeia or monographs. Monographs was the word I was looking for. So of the 39 herbs, 5 herbs indicate positive benefit with a safety of high or medium, so very safe, or some concerns. Most of the concerns are about drug interactions, and mainly of drugs with narrow therapeutic index, particularly warfarin. And these would generally not be people who are in a low risk of catching COVID. So it's important to seek advice if you are on medication. So elderflower, mallow, myrrh, ivy, and licorice. they all indicate positive benefit with a good safety profile, so long as you're not on medication. They also identified 12 promising herbs, which were garlic, andrographis, echinacea, both angustifolia and purpurea, eucalyptus essential oil, aniseed, willow, and ginger. This left 22 of unknown. They couldn't say that there was a positive, an indicators of positive benefit, because there isn't enough evidence. All of these 22 show a good safety profile, so they can be taken safely. Koch can take them safely. There is no evidence of benefit, but they would all have been chosen because they are unofficial pharmacopoeia. But on looking at the evidence, there's not sufficient to be able to make a definitive comment one way or the other. So these include fennel, aniseed, plantago, primula, milk thistle, and lime flower. 3 of these, aniseed, primula vera, which is cowslip, and lemon juice, have a caution if somebody has of a potential antiplatelet effect if somebody is on warfarin. Otherwise, they have a high safety index once you account for that. So, one of the frustrations that I've had in clinical practice is having very reluctantly overcome my own resistance. So I'm very sympathetic to other medical professionals' resistance to whether or not herbs work, is really being kind of out on a limb. So I really feel that evidence like this is very important for bringing herbal medicine into an integrated setting. So I'd now like to look, the authors then looked at international authoritative responses. And you would think, my opinion, that having looked at some of the evidence for those herbs by these independent pharmacologists, that this would be reflected in, because they didn't invent this research, they just found it, that there would be a positive international response throughout the world, because this is a pandemic after all. So in China, they've been studying an integrative effect of respiratory herbs, and particularly for flu viruses since the SARS outbreak in 2003. So there's nothing new under the sun. And they, since then and currently today, in dealing with the pandemic, and endorsed by the National Government Agency in China for Health, TCM and doctors cooperate routinely, and within an expectation of integrating evidence. In India, we have an alert for Facebook. We're having trouble with playing this video. Actions, event logs. Sorry? Okay. Shall I keep going? Keep going. So the Ayush government agency in India, which suggests coordinating treatments for early COVID and is looking at clinical research guidelines. And this is a government agency, health department for Ayurvedic, Unani, Sadi, and homeopathic medicine. And of those, the physiomedical tradition of herbal medicine that would have a lot in common with what we do with what I call classical herbal medicine, or Western herbal medicine, is in keeping and in continuity with Unani medicine. Brazil and Caribbean and other Caribbean countries are in an alliance to review evidence. I couldn't pronounce the agencies involved in cooperating, but it's a general theme. And this is my personal, this isn't quoted by the authors, but Thailand endorses the use of andrographis for early symptoms, and it's available through the public hospital system, and they have initiated a pilot study. And an anecdotal from an Ayurvedic practitioner in Galway, who is currently in Sri Lanka, but he advised me that in Sri Lanka there is a very good profile for how they're managing the disease. And every family is encouraged to do an inhalation, a steam inhalation using eucalyptus essential oil, or olivos oil for us, turmeric, or cloves, a teaspoon of turmeric and 3 or 4 cloves, hot steaming basin. And given the known properties of those herbs, that's not an unreasonable thing to do. So the Western authorities, the response is the opposite, almost universally across all of the Western.
Can you just refresh this just to see if that will help with Facebook? YouTube is fine, it's just
Refresh. Reload site. Changes you made may not be saved. Not sure about that.
sorry guys, it may come
Sorry,
back.
Guys. Okay, we're on YouTube, so if you've had your coverage interrupted, you can change to, is it live on YouTube? Oh, we're doing fine. She says we're doing fine. So Western authorities, the response is the opposite. And I'll quote from the research article. Not only is the integration with herbal medicine is out of the question from an emergency clinical point of view, but authorities are also reluctant, if not discouraging, the self-prescription of any products other than paracetamol in the early stages of disease. A further quote, media seeking answers from medical sources who advise caution against any herbal medicines in order to avoid any liabilities. Oftentimes dismissing the potential of herbal medicines to relieve early COVID-19 symptoms is just an uncritical and legalistic approach. I would suggest that it is uninformed, fear-based response, and there's no consequences to such extreme caution. And that raises the question, is it safe to fail to relieve the early symptoms? I don't know the answer because the research has never been done. And one of the important limitations of evidence-based medicine is the evidence that hasn't been produced for a variety of reasons, because the questions have never been asked and the funding has never been available. So is the disease less likely to progress if inflammation is managed, in brackets, supported from the outset? And this has the potential to be true. Is it possible that if we support in the early phases, that this will reduce the necessity for hospitalization and the further development of respiratory distress and cytokine storms? I don't know the answer to those questions, and the authors haven't addressed it, so it's just simply my questions. Coming back to what's happening, the FDA is clamping down on fraudulent sales in outlets. The Italian police are raiding retail outlets. WHO Africa support traditional medicines scientifically driven, provided a valid approach towards treatment of the virus, as long as their efficacy and safety are proven through rigorous trials. My reflection on this is hardly an even playing field when this would exclude most reference drugs who do not have evidence for this virus in question, and the evidence for general colds and flu is also not evident. The potential risks, this is again a quote from the article, and potential risks and public impact for any advice on this disease are huge. And understandably, NIM, which is the National Institute for Medical Herbalists in the UK, of which I am a member, their advice is to integrate herbal advice with any conventions, treatment, or management strategy that are appropriate for their patients and observe current infection control and management guidelines formulated by the Department of Health. So everybody, including medical herbalists, are hedging their bets, because any statement of benefit of herbs has been very difficult to advise people because of this legalistic environment. There is a consensus in the safety of herbal choices in the prevention of COVID. So that's fine. There's no controversy about that. A practical tip for you is to keep a diary of all herbs, supplements, and medication that you've taken, should you do need further treatment in hospital. That's recommended by authorities quoted in the article. As a personal rider to that, I would say bring a bag of everything that you've been taking to the hospital, because that would be helpful. It is established that viruses invade weak immune systems, and one of the dangers is from overreaction of the immune system, which is called a cytokine storm. My personal take on that question is it an overreaction or is it a collapse? Is it because the immune system is unsustainable over a prolonged period of influenza of this particular virus? And it's an important differentiation. Is it that it collapses, or is it that it's overstimulated, especially when we're thinking about theoretical concerns of herbal medicine? Aims of all treatment are to minimize the viral load. The drug antivirals and the drug immune stimulants don't influence the impact of the disease. So this is my question. Is it reasonable to expect that herbs acting as immune stimulation would have a huge impact on the outcome of the viral illness? And I really can't see that that's a realistic theory. Anything is possible. Anything can be put forward as a theory. But for it to really stand up as a theory, there has to be an element of realism about it. The authors of this paper also take this point in time to address the fact that cough, apart from cough suppression, is not mentioned in any of the endorsed referenced medications. And that's significant because it causes a huge level of discomfort, and it also is the method of spread. So the more people are coughing, the more they're spreading. So it's a very practical issue. We then go on to drug-COVID interactions. And there is nothing that substantiates that the drugs potentially worsen the symptoms, but they are cautioned to be used in as low a dose as often as possible. Specifically, by way of their action, the non-steroidal anti-inflammatories, such as ibuprofen, impair immune response and facilitate the viral load, theoretically. But there's no substantial evidence to prove that it has an outcome on the impact. Some non-steroidals potentially increase the expression of proteins necessary for entry of the virus into the cell, and this is where the ACE2 includes in this, which is relevant to the coronavirus or coronaviruses. Of concern, and I'm sure many other doctors will be astonished to hear the following, to learn the following, is that a very common effect of paracetamol or symptom is dyspnea, abnormal breath sounds, pulmonary edema, low oxygenation of the blood, pleural effusion, stridor and wheeze, which is noisy breathing, and coughing. And they quote drugs.com 2020, and the incidence as being very common, 1 to 10%. So I don't think Caught should be rushing for the paracetamol, even if she does get a headache. I would put hydration as very, very important in managing any viral illness. So herbal COVID interactions then, so herbal effects on the disease, acting as immune modulators. The French authority issued a warning against all herbs acting as an anti-inflammatory or immune modulating activity, unless patients are COVID negative, which is a huge, broad statement, and it includes many foods such as turmeric, and it also includes vitamin D. Vitamin D acts as an immune modulator. So are they really saying that somebody should stop their vitamin D or not use vitamin D unless they've proven COVID negative? And proving COVID negative is that there's all kinds of logistical things, as we've known recently in Ireland, to do with the availability of testing. In principle, herbs down-regulating ACE2 may improve defences, and there are 2 listed. The only one I'm familiar with was DOC. An enhanced potential of ACEU is curcumin and rosemary. So this immune modulation can be inhibitory or stimulatory, and effects on inflammation can be pro-inflammatory. So ironically, all of the herbs that are traditionally used and have evidence of benefit include elderflower, mushrooms, medicinal mushrooms that have polysaccharides with an effect on the immune system, both the echinaceas, and plants and foods rich in vitamin D. Now, we are talking about potential and theoretical risks here, and in another part of the article in the review of echinacea, more generally, and this is a quote, more generally, herbal treatment, herbal prescription or treatment are not known to rigorously block inflammatory process and to negatively affect immune responses. So these are theoretical potentials in the same way that there are significant theoretical potentials for non-steroidals. So after all that, what would we think the Caught should do? She's at very low risk of a cytokine storm, and if she used some of the herbs, there is a potential possibility, and theory, I'm putting it forward, that the herbs may help avoid such down the road possibilities. Entirely theoretical. The other consideration is antithrombotics. Thromboembolism is a feature of late event hospitalized patients. They don't recommend a herbal strategy or a medical strategy. And the treatment is rest, hydration, lying prone, and after that it's artificial ventilation and trying to support life systems that are under threat. And greatly appreciative for all of the efforts that are being put in and all of the staff who are turning up for frontline. Absolutely take my hat off for them. But this isn't a concern that we're dealing with when we're talking about adjuvant therapy for early symptoms. So it's a different ballgame. The authors do point out that there's no need for zero tolerance of potential issues if there is insufficient information. So if there is theoretical, possible, potential, may, can issues, this is not a reason for zero tolerance, because they give an example of allicin, where below a certain percentage there's no implications for platelet. And if you just completely ban garlic, then you are having an unnecessary zero tolerance. That's the example they give. There is, in general anesthetics and herbs are a concern to anaesthetists, but avoiding comfort and early management is not a strategy for banning. There's no strategy for banning herbs when the use of paracetamol is endorsed with all of the considerations that's involved in that. So just comparing like to like and risks to risks, it's not something that I think is of concern for early management. So at the end of all of this, and you're doing very well, there's 2 pages left, the authors recommend the scientific community to prioritize working on these herbals towards integration into clinical use. This is based on their anti-inflammatory, immune modulatory, and antitussive. And I would argue that the herbs soothe the cough rather than are being antitussive, which is anti-coughing. There's some evidence as well of benefit to people with asthma specifically, and the 2 herbs that they quote with safe to use in patients with asthma, not prevention, not cure, let me be absolutely clear all the way through this, are licorice and aniseeds. And when we come on to food support, we'll see that nigella seeds, there can also be an argument for nigella seeds being helpful. And let's remember that the unknowns, the herbs that aren't a positive benefit or a probable benefit, leads, I think it was 22 unknown herbs, which have a good safety profile, but not enough evidence. They also looked at peppermint as a well-used herb. I would have added in yarrow as well, because traditional flu tea anywhere between North America and Croatia, where I saw it at a herbal market, a herbal event, used by locals, is yarrow, elderflower, and mint. Would be well used, well tried, and beneficial for other reasons, apart from just a direct effect on cold symptoms. So in the conclusions, there's just an acknowledgement that herbs are not magic bullets, and I absolutely agree. Neither are drugs in this event. In my opinion, herbs aren't even a green bullet, but they are rarely used as simples, and this review does not cover the use of blends of herbs. And the blends of herbs are based on an even more complex soup of constituents, complexities of actions, synergy, network, pharmacology, signaling at very low doses, bringing in mechanisms of action of hormesis. This is all my experience and my background, not the authors. And whole herb safety. And the authors do say that these should be recognized, authorized products. And that's another whole webinar, because that it's safety of whole herbs is much more likely, rather than many of the products are extracts or novel foods or various other ways of patenting, basically, and marketing. I would say, again, this is my opinion, it is always better to intervene early. So I'm very pleased that this is based on early intervention. I would say that people need to have these herbs in the house if you want to use herbal medicine, and you use it from the minute you get an I'm renowned for my moment. The moment is when you go, I'm heading for trouble here. Parents know it with their children. You know they're going to get sick before they get sick, because they go, fretful, a little bit hot, off their food. So there's always kind of early symptoms of things going wrong. And whole herb safety is well characterized, again, my opinion. I'd like to reiterate the framework of the PROACT strategy, PROACT URL strategy. It's just so nice to see people thinking outside the box, and a whole group of my colleagues, if I can call them that, with an interest and a passion, presumably to have done all of that work. So I'd like to thank the authors. I said it was substantial. The written pages are 30 pages. It took me 2 days to digest it all. And 14 pages of references in print, so small that I definitely needed my reading glasses, just to give you an overall impression. So I'm going to leave their excellent article and go on to like the general consideration as a clinical medical herbalist, because there's a real dearth of involvement of clinical medical herbalists, which is understandable because the profession isn't regulated, but it is very much there. And NIM have been in professional bodies since 1864. So it's not that herbal medicine isn't available, it's just that it's little known, which is hardly surprising, as we've seen. So as a medical herbalist, I would be treating the whole person, and that includes gut integrity. And a significant number of people with COVID either present with gut problems or have major discomfort and disorder of their functions, their digestive functions as part of COVID. So I would always include gut integrity, very important for recovery phase. And I would also use adaptogens. Adaptogens are herbs that help the performance of the physiological functions in response to any stress. And there are different adaptogens that are useful for different presentations. I would also advise the Sri Lankan inhalations for the whole population, but certainly if you're sick. And so the inhalation is a pot of water with eucalyptus oil, a teaspoon of turmeric, and 3 or 4 cloves of garlic. You can alter the strength of any of those to do with your own tolerance. Not for children under 18 months. In fact, not for children who can't sit still. So whatever age your children are, that they can sit still, because obviously it's a pot of boiling water. And if there are any children around, please wait until they've gone to bed. Also, eucalyptus inhalations can cause stridor in babies under 18 months, so definitely don't go there. I would think everybody should be taking vitamin D. The EFSA recommendations are for 400 international units a day, at the same time as saying that 4,000 units a day is not harmful, even if used over a lifetime. So you want something in between those. I recommend my patients to take 2,000 units a day. You can take them 1 day a week to cover the whole week. So you can take 15,000 units a week on a Saturday. And also vitamin C, generally I advise 1 gram a day. And if you're ill, that you go up to a level that you do or you don't have diarrhea. So I start at 3 grams if you're ill, and go down if you get diarrhea, and go up to 5 if you don't. For those with underlying vulnerabilities, I suggest seeing a medical herbalist. If you're not recovering well, see a medical herbalist. If you have a prolonged illness, see a herbalist. And again, I suggest you have the herbs in the house. You can discuss as an individual approach, discuss with a medical herbalist, and our staff are available if people do want to talk about what might be useful to them. And that would be free of charge for advice. So I think I can't read my last sentence, but I think you've all been very patient so far. Nigella seeds are very good for essential fatty acids anti-inflammatory, and particularly there's a small piece of evidence which shows that it's beneficial for asthma. But very nourishing. I frequently recommend it for the whole population. Don't forget hydration. And I hope you all stay well. And if you aren't well, I hope you recover well. And thank you again for all the researchers.